What is barcode medication administration?
Barcode medication administration is also known as BCMA. It is a barcode system designed to prevent medication errors in healthcare settings and improve the quality and safety of medication administration.
By the end of this course, you will be able to state the reasons why BCMA will be implemented across the health system, state the 8 rights of patient safety for medication administration, describe the workflow for BCMA, and document medication administration using a BCMA scanner. At the end of this course is a short test to assess your knowledge and understanding of BCMA. You must obtain a score of 100%. Incorrect answers will be displayed in red font and must be corrected. You will have unlimited opportunities to correct your responses. In the following few minutes you will hear messages from Maureen White, Senior Vice President and the Chief Nurse Executive, along with Lee Briscoe Dwyer, Chief Pharmacy and Medication Safety Officer, about the importance of BCMA to our health system.
Hello, I'm Maureen White, the Senior Vice President and Chief Nurse Executive. Healthcare today is moving at a faster pace than ever before. With all of the changes that are occurring, it is vitally important that we enhance our efforts to ensure our patients' safety. On a daily basis, we hear about medication errors, from giving the wrong medication dosage to giving the wrong medication to the wrong patient. These types of errors can cause harm, and at times can cost our patients their lives. The Institute of Medicine reports that medication errors result in 7,000 deaths annually. A majority of these errors are occurring at the bedside with hospitalized patients. A 2006 landmark report from the Institute of Medicine on preventing medication errors noted that a computerized provider order entry system was a crucial safety measure that needed to be implemented widely in all hospitals throughout the United States. I'm pleased to report that by July of 2014, we will have completed our rollout of a computerized provider order entry system in all hospitals within our system. But this is not enough. More needs to be done. In 2014, we will be implementing a bedside barcode medication management system. Barcode management technology was introduced by clinical integration systems in order to automate the ordering process, prevent errors, increase accuracy, and remove handwriting illegibility as a barrier to patient safety. Studies have shown that 54% of errors regarding medications are reduced with the use of barcode medication management systems at the bedside. These are impressive results, and results that we cannot ignore. We have begun the planning process to roll out a bedside barcode medication management system in 2014. Pharmacy is currently undertaking painstaking efforts to ensure that in the coming months, medications are broken down into unit doses and assigned a specific barcode number. For clinicians who administer medications, the medication administration process will change. Administration of medications will require that you scan the patient's barcoded identification badge along with barcoded medications. This information will then be verified by the electronic medication administration record to ensure that we are giving the right patient the right medication in the right dosage at the right time via the right route. While these changes may seem onerous to some, they are vitally important to our efforts. We must embrace these new technologies and utilize them to their fullest capacity to ensure that we are continuing to enhance our patient safety efforts. Thank you.
Hello, I'm Lee Briscoe Dwyer, the Chief Pharmacy and Medication Safety Officer. It is my pleasure to participate in the launch of the health system's next step forward in pursuing our goal of providing the safest care: barcoded medication administration. When used properly, barcoded medication administration, or BCMA, is one of the most effective means to improve safety surrounding the administration of medication. Studies evaluating the use of this technology show not only a significant decrease in medication administration errors, but a decrease in overall adverse events associated with medication use. Research has demonstrated that approximately 30% of serious medication errors occur at the time of administration. This number has even more significance when put into the context that as a system, we administer nearly 20 million doses of medication every year. These numbers can't be ignored. As a system, we have chosen to invest our time and financial support into the technology, capital equipment, supplies, and training for BCMA because it is the right thing to do. It is the safest thing to do. It will require a change in how you do your work, but in return, we will have a medication administration process that protects you as well as your patients. To be effective, BCMA must be used for every dose, every patient, every time. Our hospital pharmacies and central pharmacy have worked tirelessly with our colleagues from IT, nursing, and respiratory therapy to prepare for this project. We have standardized products, doses, and processes to make sure that every dose arrives to the unit with a valid barcode that is ready to be scanned and administered to your patients. You have our commitment that the medications you need will be available when you need them, barcoded and ready to use. We need your commitment that you will use this technology for every dose, every patient, every time. Thank you.
How do I know what to do given the different scenarios I'm faced with each day?
There are varying situations you will encounter daily. The situation guide was created to guide you through these. It includes an explanation of the different alerts you will see, when you would see these alerts and what you should do. It will also address different medication types, and what to do in a specific situation. You can find the guide on intranet on the summarize page.
Following the BCMA workflow will ensure the 8 medication administration rights are followed for every patient every time. The 3 newest medication administration rights are the right reason, the right documentation, and the right response. The following medication types will be excluded from BCMA. You will not scan IV chemo, code medications, and rapid response team medications. These signatures will be captured on the paper MA. Additionally, free text medications, blood products except albumin should be marked as done on the EMA. In the following lessons you will view how to utilize barcode medication administration in various clinical situations. After viewing the various situations you will be asked to practice the lesson interactively. In this first lesson you will learn how to document medications with a perfect match in the BCMA module.
Good morning. My name's Susan. I'm your nurse for today. I'm here to give you your medication.
Good.
Now, can you just tell me your name and your date of birth while I check your wristband?
My name is Mike Brady, and I was born December 6, 1949.
Great. Now, I understand your back pain is a 4 out of 10 on the pain scale?
Yeah.
I'm going to give you Percocet for your pain. The Percocet can cause you to have constipation, so I'm going to give you Colace to prevent the constipation. Do you have any questions about the medications?
No, I'm okay right now. Thank you.
Great, cut.
I'm also going to start your Ansef, which is an IV antibiotic. Do you have any questions for me about this medication?
No.
We'll now interactively practice the perfect medication pass process.
After verifying that the correct patient is selected, click on the Work List Manager icon to access Mike Brady's EMR. Click on the BCMA icon to begin the process of documenting medication administration. You would now scan the patient wristband. We will scan it for you. The patient information is loaded in the BCMA module. The patient's name, MRN number and visit ID, birth date and other relevant information is displayed in the header. The medications to be administered within a 2 hours time frame are listed on the left. The time frame can be changed by using the drop-down. On the right we will see details of the specific medication after we perform a scan, in particular match result. Below we will see alerts and warnings. We will now scroll down to view other orders. We will begin by scanning the Percocet. Note, it is important to make sure the cursor is in the scan drug field for the scanning to work properly. We will scan the medication for you. After the medication has been scanned, the task form will open, allowing you to document the proper fields and to access the flow sheets. In this scenario we have already completed the appropriate documentation. Click OK. The system found a match for the medication. We will now scan the call-A's for you. The system found an immediate match. No document form opens for this medication. We will now scan the answer for you. The task form opens up. Click OK. We have now completed the scanning of the medications. Click Scan Complete. After ensuring that you have physically completed these tasks, you would click Medication Given. Click Medication Given now. Note that these 3 medications have been marked as done on the EMR. Click Close to go back to the patient list.
Completed the perfect medication pass lesson. In this lesson you will see how the BCMA module warns you when there is an inconsistency between the selected patient and the scanned wristband.
Mr. Brady, you've given me your name and date of birth. Can I see your wristband, please, to scan? Why didn't this work? Let me close the BCMA window and go back to the patient list and see what happened. Oh, I was in the wrong chart. Let me open Mike Brady's chart. Can I scan your wristband one more time, please, Mr. Brady? Thanks.
We'll now interactively practice a no-patient match scenario.
We have selected the patient Mr. Brady. Click the Work List Manager icon to access the EMR. We will now continue the process of documenting medication administration. Please click on the BCMA icon. You would now scan the patient wristband. We will scan it for you. In this scenario, you had mistakenly selected Greg Brady and not Mike Brady from your daily patient list. The system will inform you of this incorrect scan through this error message. Now click OK. You need to close out of BCMA to select the correct patient from the patient list. Click Close. Click Close to return to the patient list. You would now be able to select the correct patient from the list. Note that if the patient is not on the list you can search for the patient with the Find Patient icon or navigate to the correct unit using the Current List drop-down.
You have now completed the No Patient Match lesson. Lesson you will learn how to document a medication that requires the scanning of multiple tablets.
Good afternoon. My name is Michael also, and I'm going to be giving you your medication today. I will need you to confirm your name and the date of your birth, please.
I'm Mike Brady. I was born December 6, 49.
I'm going to give you your water pill, which is called Lasix.
Thank you.
Okay. Here you go.
Thank you.
You will interactively practice the documentation of a medication that requires the scanning of multiple tablets.
You will now document the administration of Lasix 40 mg. This was dispensed by pharmacy as 220 mg tablets. Click the BCMA icon to begin the process. You would now scan the patient wristband. We will scan it for you. You would now scan the medication barcode. Note that the system informs us that this is a partial dose. Only 20 of 40 mg have been scanned. In the match results field we can see that we have scanned one of the two required scans. We must now scan the other tablet. The system now recognizes a complete match. We could now scan additional medications. In this case, click Scan Complete. After ensuring that you have physically completed these tasks, you would click Medication Given. Click Medication Given now.
You have now completed the multiple scans lesson. In this lesson you will learn how to document a medication that, once scanned, matches multiple orders.
Hi, Sue.
Hi, Mary.
Someone called us for respiratory treatment?
Yes, that was one of Mike's patients, bed number 10.
Okay. Thanks. Hey, Mike. One of your patients requested a respiratory treatment?
Yes, Mr. Brady is requesting an additional nebulizer treatment.
Okay. Thanks. Hello, I'm Mary, your respiratory therapist. The nurse tells me that you've been wheezing and you would like another treatment of albuterol.
Yeah.
Can I have your full name and your date of birth?
My name is Mike Brady. I was born December 6, 49.
Okay, thank you very much, Mr. Brady. I'm going to listen to your lungs. Do you mind? Okay. Just take deep breaths. Just lay back. Let me see. Here's the PRN. I'll select that as the match.
We will now interactively practice the multiple match workflow.
We will now document the administration of the PRN albuterol. Note that there is another scheduled order for albuterol. Click the BCMA icon. You would now scan the patient wristband. We will scan it for you. We will begin by scanning the albuterol. Note, it is important to make sure the cursor is in the scan drug field for the scanning to work properly. The system associates multiple matches to this medication's barcode. In this case you will select the PRN order. And then click Select Match to confirm. After the medication has been scanned, the task form will open, allowing you to document the proper fields and to access the flow sheets. In this scenario we have already completed the appropriate documentation. Click OK. The system now indicates that a match has been made. Click Scan Complete. After ensuring that you have physically completed this task, you would click Medication Given. Click Medication Given now. Note that the correct albuterol is marked as done on the EMR. Click Close to go back to the patient list.
You have now completed the multiple match lesson. In this interactive lesson you will learn how to document medications that, once scanned, do not have a match.
After verifying that you have the right patient selected, click on the Worklist Manager icon to access the patient's EMR. Note that your patient has an order for Keflex to be administered at 6 p.m. However, your patient will be leaving the unit and you need to give the medication early. Click the BCMA icon. Would now scan the patient wristband. We will scan it for you. Observe that the Keflex is not among the displayed tasks. We will scan the Keflex barcode. Note, it is important to make sure the cursor is in the scan drug field for the scanning to work properly. The system alerts you that there is an order for Keflex, however it is outside of the BCMA timeframe. Click Discard. Click Yes to confirm. Click the drop-down arrow to change the time range. Select 3. More orders are available in the BCMA orders queue. We will scroll down for you to view the Keflex order. Now you can see the Keflex order. We will now scan the medication for you. Note, you would have to click in the scan drug field first. The system will alert that the medication is being documented early. Click Acknowledge. And now click on the ellipsis next to the override field to select a reason. We will scroll down for you to the appropriate reason. Now select Administered Early.
In this interactive lesson you will learn how to document medications that, once scanned, do not have a match.
After verifying that you have the right patient selected, click on the Work List Manager icon to access the patient's EMR. Note that your patient has an order for Keflex to be administered at 6 p.m. However, your patient will be leaving the unit and you need to give the medication early. Click the BCMA icon. You would now scan the patient wristband. We will scan it for you. Observe that the Keflex is not among the displayed tasks. We will scan the Keflex barcode. Note, it is important to make sure the cursor is in the scan drug field for the scanning to work properly. The system alerts you that there is an order for Keflex, however it is outside of the BCMA timeframe. Click Discard. Click Yes to confirm. Click the drop-down arrow to change the time range. Select 3. More orders are available in the BCMA orders queue. We will scroll down for you to view the Keflex order. Now you can see the Keflex order. We will now scan the medication for you. Note, you would have to click in the scan drug field first. The system will alert that the medication is being documented early. Click Acknowledge. And now click on the ellipsis next to the override field to select a reason. We will scroll down for you to the appropriate reason. Now select Administered Early. And then click OK. Click Close. A match was found. Click Scan Complete. After ensuring that you have physically completed this task, you would click Medication Given. Click Medication Given now. The Keflex is now marked as done on the EMR. Next we will document the ANSEF IV piggyback. Observe that this order was modified from a frequency of Q8 to Q6. Click on the BCMA icon. You would now scan the patient wristband. We will scan it for you. We will scan the ANSEF. Because pharmacy associated this barcode with the Q8 order, which has since been modified, the system will not find an active order. You will click on the order you want to document in the order queue on the left side. Click No Scan. The task form opens. You would now be able to document in the appropriate fields if necessary. In this case, click OK. The system warns you that you have chosen to administer a drug without a scan. Click Acknowledge. And then click on the ellipsis next to the override field to select a reason. We will scroll down for you to find the correct option. Select Frequency Change, Pharmacy Relabeled. OK. Click Close. Scan Complete. After ensuring that you have physically completed this task, you would click Medication Given. Click Medication Given now. Correct ANSEF order is now marked as done. In the next scenario, you find vancomycin in the patient's med cart. This is actually from an older order and it is not currently active. You do not notice and begin the scanning process. Click the BCMA icon. You would now scan the patient wristband. We will scan it for you. We will now scan vancomycin. The system alerts us that there is no match for this scan and that you have scanned a medication that does not have a currently active order. You realize your error and click Discard. Click Yes to confirm. To navigate back to the EMR in order to verify that the medication was in fact incorrect, click Close. We will scroll down for you to see if there is a vancomycin order. There is no vancomycin order. Click Close to go back to the patient list.
Completed the No Match on Scan lesson. In this interactive lesson you will learn how to generate a stat medication and override the No Match on Scan in BCMA.
When a medication needs to be administered in an emergency situation and has not been verified by pharmacy, you must first generate the task on the Orders tab. To do so, we will right-click on the additive for you. Please click Generate Task. Click the down arrow to select the reason. Click Emergency Situation. Click OK. Click on the Work List Manager icon to access the EMR. Note that the additive is now on the EMR. Please click on the BCMA icon. You would scan the patient wristband. We will scan it for you. You would now scan the medication barcode. Note that the cursor must be in the scan drug field. The BCMA module identifies a task that can be matched with the scan medication. Please click on the medication. And then click in the checkbox to confirm the dose. Then click Select Match. The task form opens allowing you to document the appropriate fields. We will scroll down to review other fields. If the additive requires a cosigner, you can click on the drop-down arrow next to the cosigner field. The cosigner would then place their user ID and password in the appropriate fields. Please check with your manager regarding your unit policy for cosignature. Now click OK. In this window, you will be able to view any warning. In this case, the medication was not verified by pharmacy, as detailed here. Please check the 8 rights prior to administration of any unverified medications. Click Acknowledge. Click on the ellipsis to select and override reason. Select Emergency Situation. Click OK. Then click Close. You could then scan additional medications. In this case, you will click Scan Complete. After ensuring that you have physically completed this task, you would click Medication Given. Click Medication Given now. Please note that the additive is now marked as done. Click Close to go back to the patient list.
Completed the Generate a Stat medication lesson. In this interactive lesson you will learn how to document a product that, once scanned, is not found.
We will document the administration of the stat Zofran order. You are unaware that pharmacy has no scan code associated with this medication in the Sunrise database. Click the BCMA icon. You would now scan the patient wristband. We will scan it for you. We will begin by scanning the Zofran. Note, it is important to make sure the cursor is in the scan drug field for the scanning to work properly. In the match result field it is indicated that the product is not found. This alert will appear when pharmacy has not associated the medication with a scan code in the Sunrise database as detailed in the Error tab. Normally we would have to contact pharmacy and have them provide a functioning barcode. However, this is a time-sensitive situation, as the medication has to be administered stat. Therefore we will have to override the scanning. Select the task on the left side. And click No Scan. You will then select emergency situation, as the medication has a stat priority. Note, you should only be overriding BCMA and giving meds when unable to scan in an emergency situation. Otherwise, wait until pharmacy relabels the product. Click Close. Click Scan Complete. After ensuring that you have physically completed this task, you would click Medication Given. Click Medication Given now. Note that the Zofran task is marked as done on the EMR. Click Close to go back to the patient list. It
is important to follow up with pharmacy to inform them of the issue so they can correct it for the future. You would need to fill out this form and place the medication in the bag to be sent back to pharmacy. Note that you would use the same form and process if the barcode were missing. You have now completed the Product Not Found lesson. In this lesson you will learn how to document the administration of an order which requires a portion of the dosage dispensed by pharmacy.
We will document the administration of the Lopressor. The order is for 12.5 mg twice a day. However, pharmacy dispensed it as a 25 mg tablet. Click the BCMA icon. You would now scan the patient wristband. We will scan it for you. And you would now scan the medication. You will be prompted by a warning indicating that the dose has been dispensed as 25 mg tablet rather than 12.5 mg as ordered. Click Acknowledge. Click on the ellipsis to select and override Click Partial Dose. Click OK. And now, click Close. Could then scan additional medications. In this case you will click Scan Complete. After ensuring that you physically split the tablet and complete the administration, you would click Medication Given. Click Medication Given now. Please note that the Lopressor is now marked as done. Click Close to go back to the patient list.
Completed the partial dose lesson. In this interactive lesson you will learn how to override barcode verification.
You now need to urgently administer the Lasix. The order has been verified by pharmacy but you realize that the barcode is damaged. You need to override barcode verification. To begin, you would right-click on the scheduled task on the EMR. We will right-click for you. Click Mark as Done. The system will prompt you to give a reason for the override. Click the down arrow to access the list of reasons. And select Barcode Unreadable. Click OK. The task form opens allowing you to document the appropriate fields. Click OK. Note that the Lasix task is now marked as done. Click Close to go back to the patient list.
Completed the barcode override lesson. We will now discuss how to document the administration of multiple dose medications.
For multi-dose medications like nystatin cream, the medication will have an NDC code that will be scanned with each administration.
We will now discuss how to document the administration of medications that have multiple barcodes.
When you have multiple barcodes on the medication, it is important to scan the correct barcode to complete the documentation of the medication. For IV piggyback medications mixed on the unit, the barcode on the vial is preferred. The pharmacy label will be your second choice. For IV piggybacks compounded by pharmacy, you will scan the barcode on the pharmacy label. Note that the barcode is intentionally small size to allow more room for other relevant information. The highly sensitive scanners will effortlessly read it. For pre-mixed bags with commercial barcode, the product's NDC barcode on the bag or vial is scanned.
In this interactive lesson you will learn how to mark a task is not done in the BCMA module.
In this scenario, please note that the patient has a digoxin order, however we will mark this task as not done because the patient's heart rate is below the specified parameter. Click the BCMA icon. You would now scan the patient wristband. We will scan it for you. The digoxin order is listed in the tasks on the left side. Click the task to select the order. Now you would right-click on the selected task. We will right-click for you. Click Mark as not done. You must now document a reason for marking the task as not done. Click the drop-down arrow. Select Hold Dose for parameter. Now click OK. Digoxin was removed from the task list. Click Close to go back to the EMR. Note that the digoxin is marked as not done on the EMR. Click Close to go back to the patient list.
Completed the Mark as not done lesson. In this interactive lesson you will learn how to document the administration of a FREETEXT medication.
You will now document the administration of the niaspan. Note that this was entered as a FREETEXT medication. In this case you will be document the administration directly on the EMR, without the use of BCMA. You would right-click on the scheduled task on the EMR. We will right-click for you. Click Mark as done. The task form opens allowing you to document the appropriate fields. Once documentation is complete on the task form you would click OK. Click OK now. The FREETEXT medication task is now marked as done. Note that blood products are also documented this way with the exception of albumin, which is scanned. Click Close to go back to the patient list.
Completed the FREETEXT medication lesson. Several reports will be available to assist in achieving patient safety and operational excellence. Analysis of metrics and reports will assist in highlighting best practices and in identifying effectiveness opportunities. BCMA will not be available during downtime. Med administration will be documented on downtime EMR form. When downtime is over, EMR needs to be reconciled. RN will mark as done by other to document med administration during downtime. When BCMA override alert appears in EMR, RN selects downtime recovery as reason for not using BCMA. Detailed downtime procedure documents can be found on intranet on the Sunrise page. Medication administration errors have the potential to cause serious harm to patients. BCMA is being implemented to increase patient safety and decrease errors at administration. It is a safety net at the patient bedside which will protect the patient along with the clinical staff. Thank you for your ongoing commitment to patient safety, and remember, every patient, every dose, every time. Congratulations! You have completed the Barcode Medication Administration, BCMA, in Sunrise course.